Okay, this is the male bladder along with the prostate. This is the anatomical position, and the orientation. You can imagine this is the anterior abdominal wall here. So right behind it you have the bladder. This is the apex of the bladder. This is the apex of the bladder, okay? And if we turn it, this is the posterior aspect of the bladder, okay? This is the base of the bladder. So how can you differentiate between them? It's obvious, and it's also by the entrance of the ureters. And here are the ureters entering the posterior aspect, okay? Along with other things. So the surfaces of the bladder, this is the apex, as we said, the anterior aspect. This is the superior aspect of the bladder, okay? This is the base here, lying behind, and the two infralateral surfaces. This is one of them, and the other here, okay? So you can imagine it. Now, on the posterior aspect, other distinguishing marks, this is the ductus deferens, or the vas deferens, okay, here. And on this side, we can actually follow it. This is the ductus, okay? This is the vas, and here it's dilating to form the ampulla. So you can, it's better to say this is the ampulla of the vas deferens, okay? Here. And below it, of course, is the seminal vesicles. They're lobulated on both sides. If we go to the inside of the bladder, you can see the region of the trigone. This is the site of entrance of the right ureter here, and the same on this one on the left side. This is for the entrance of the left ureter, and below this is the internal urethral orifice, for which leads to the urethra. Okay, the two orifices for the ureters are separated by the interurethric ridge or bar above, and this is the uvula vesicae, which is formed in elderly men by the median lobe of the prostate. Okay, the rest of the bladder is of course lobulated. It's transitional epithelium. So this is an undistended bladder, but this part, the trigone, can be distinguished by being smooth. And below, of course, below the bladder, as we said, since this is the internal urethral orifice, so down it would lead to the prostate. Here, this is the prostate, and of course the urethra is supposed to be inside of it. Okay. This is the prostate. Here. Again, for the orientation, this is the anterior aspect, right around the neck of the bladder. This large part. Now we prostate. ماشي؟